Safeguarding, Andrew speaking.
The primary role of safeguarding is to help and inform and advise and direct practitioners matters regarding safeguarding. So it's advising how to keep that person safe, how to use their skills that they already have in assessment and being able to put action plans in place. Again, also help and support staff in knowing who further to report safeguarding to in Leeds or in York, because obviously safeguarding isn't just about single professional response, it's about whole agency responses.
Every day in Leeds there's a front door daily meeting to discuss all of the cases of domestic abuse that have occurred the day before or the weekend prior, and that's called a MARAC, which is a multi-agency risk assessment conference.
So part of our new practice within our safeguarding team is our new duty system. So our duty system entails a 5-day-a-week service, and each one of the practitioners is allocated on a particular day of the week where we look at supporting staff with any safeguarding concerns or any incidents that may come up where staff need support from a safeguarding perspective. And as part of that system, we work with all services across the trust, so they all have access to us, and that might include supporting staff with issues either on the ward or looking at whether we need to attend any multidisciplinary team meetings, which would then be allocated as per which practitioner would be able to attend on that day.
All LYPFT staff have a key role to play when it comes to safeguarding children. So in identifying abuse, sharing information with appropriate agencies, and also taking prompt action. That prompt action can be making a referral to Children's Social Services because a child is deemed to be at significant risk of harm, contacting other services to provide some support to families over a short period of time, or it may even mean contacting the police if there is a risk to life.
I think a lot of our early intervention work is around recognising vulnerability, thereby preventing hopefully a person needing to fit into certain groups that may ultimately present harm to them, like gang cultures or radicalisation and counter-terrorism. We have a number of different serious case review processes. One of those is safeguarding practice reviews where a child has died, or been seriously injured and abuse has been a factor. Or we have the same for adults, the Safeguarding Adults review. We also have domestic homicide reviews where a person's being killed by someone they were in a relationship with or a family member in a domestic situation. So as a team we have to create reports and look at the learning from that as to what we could have done differently. We also look at good practice as well increasingly, which is much more positive because it often feels quite punitive sometimes, but we try and look at what learning's taken place as a result of those deaths and how we can help stop that from happening in future.
We can develop care plans to keep them safe in a way that best meets their needs and wishes. So it has to be service user focused. And it's also recognising where perhaps a criminal act has taken place, and it's then making sure that the clinicians are giving the appropriate support and advice where that happens. It's making sure that a child or a vulnerable adult is kept as safe as possible, is given the best advice about how to keep themselves safe.
I know the engagement team are working increasingly with young carers around seeking their views about what it's like to be a child in a family where there's parental mental ill health and what the impact is on them.
Because at the end of the day, what we want is to safeguard children effectively and ensure that children have a positive outcome.
So the safeguarding agenda as a whole has increased dramatically over the last 5 to 10 years. So safeguarding in the organisation, I only just did children when I first started. The adult agenda has increased, so there's a Safeguarding Adults Board as well, which wasn't in existence when I first started. And the prevent agenda around counter-terrorism and radicalisation. That sits under Safer Leeds, as well as the domestic abuse area as well. So there's lots of different strands to safeguarding that weren't in existence sort of 10 years ago.
Part of the safeguarding team's role is also to provide training to all staff members, so that all staff are aware of their roles and responsibilities when it comes to safeguarding children and adults. So what that means is staff being able to recognise abuse, how do they respond to that recognition, who are they going to speak to, how do they share that information, and how do they make appropriate referrals.
Working as part of the safeguarding team makes me feel quite positive at times and makes me feel that I've done something that's quite productive, and I've been able to support staff at being able to deliver really good patient-centred care.
I've always believed in keeping service users at the forefront of what we do. So it's about how we embed that within the advice that we give. It's about how we evidence that through making safeguarding personal. And when that happens and all clicks together, that's really positive. First of all, it's positive for the service user, it's positive for the practitioner, it's positive for me and the team, and it's positive for the trust.